So let's start with the basics. What are cognitive distortions? A cognitive distortion is a pattern of irrational or inaccurate thinking that can negatively impact how you perceive reality, feel, and act. These distortions can lead to increased anxiety, depression, and other mental health issues. Cognitive distortions are influenced perspectives that we all take on about ourselves and the world around us. Irrational thoughts and beliefs that we mistakenly reinforce over time. Cognitive distortions are patterns, and so they're often subtle and develop over time. So at times it can be difficult to recognize when they become a part of our everyday thoughts. All cognitive distortions are patterns in our thinking and believing. They're all false or inaccurate, and they all have the potential to cause overall psychological damage if they are not questioned. Sometimes cognitive distortions are referred to as thinking errors. So why are cognitive distortions important to discuss? A study completed in 1987 by Burns, Shaw, and Croker showed that cognitive distortions were related to symptoms of depression. Many of our negative feelings are directly related to or based upon our cognitive distortions. So how many are there? Well, there are a lot of cognitive distortions. In this session, we're going to focus on the top 11 recognized cognitive distortions, but please feel free to research others. So let's start with all or nothing thinking. This is also known as polarized thinking or black and white thinking. Only two opposing possibilities, inability or unwillingness to see grayness. Fantastic or awful. Perfect or total failure. So some examples of all or nothing thinking. Number 1, if I can't clean the whole house today, what is the use in cleaning it at all? Number 2, if my job does not recognize my contributions, why should I even try? Number 3, I fell off my diet yesterday. I'm a complete failure. Might as well just eat what I want. Can you see how some of these thoughts might derail the good work you've been doing? The next cognitive distortion we're going to discuss is catastrophizing. This is also known as fortune telling or predicting the worst. An example of catastrophizing would be, if my presentation does not go well, I'm probably going to get fired. Or, if I don't plan the perfect date night with my wife, she's probably going to leave me. Or, I yelled at my kids this morning. I must be a horrible parent. Again, do you see how this pattern of thinking can cause negative emotions? Moving on, emotional reasoning. The acceptance of one's emotions as facts. This is a tricky one. If you feel it, it must be true. And you're going to ignore all of the contrary evidence, the facts. Some examples. I feel jealous of my spouse's relationship with his coworker. Therefore, he must have feelings for them. Or, I don't like my coworker because she hates me. Or, I don't like to be alone, and I know you are going to leave me. Do you see how these thoughts are purely based off of emotions and how they might again derail the good work that's been going on? The next one is mind reading. You believe that you know what others are thinking. The negative interpretations that we jump to about others and what they're thinking. Some examples. My boss didn't greet me when I came to work. She must be mad at me. Another one. My husband didn't pay attention to me. He must not want to be with me. And lastly, that woman, who's a complete stranger, has a look of disgust. She must not like how I am dressed. Again, do you see how this pattern of thinking can really impact our emotions negatively? Next up, we have mental filter. You ignore all of the positives and only see the negatives. Some examples: I hate work because it's always stressful and awful. Another one: your partner after 10 good days says, we just aren't on the same page today. The thought that you have, our relationship is doomed. The next one is overgeneralization. You view one negative outcome as evidence of future outcomes. Some examples of that one: I didn't do well on that test, so I'm probably going to fail college. I had a bad date from a dating site, so I'm sure they will all be awful. All cats have 4 legs. I have 4 legs, therefore I am a cat. This is a dog saying this. Does this make sense? Let's check out some more. The next cognitive distortion is discounting the positives. You might also see it referred to as disqualifying the positive. This is dismissing positive experiences or accomplishments as insignificant. Some examples: I caught a touchdown pass, but that touchdown pass didn't matter because the coach knows I'm not good. The flowers that my husband brought don't matter because he neglects me anyways. The next one is magnification or minimization. This is exaggerating the importance of negative events or minimizing the importance of positive ones. So blowing things out of proportion or ignoring the good things. An example: my friend was cranky on the phone today. We can't be friends anymore. That would be magnification. It doesn't matter if I'm late to work again. It's only once a week. That would be minimization. Next up, should statements. These make unrealistic demands on yourself and on others. It's having rigid or unrealistic expectations. What you or others should, ought to, or must do. Some examples: my spouse should have dinner on the table when I come home. My kids should automatically clean their room. I should be able to learn this new program on the computer quickly. The problem with these statements is that they can cause guilt when we cannot live up to them, or disappointment and anger when others cannot live up to them. The next cognitive distortion is labeling. These are global statements that are usually negative about yourself. Extreme example of overgeneralization, where we assign judgments of value to self and others based on one single instance. For example, I am stupid because I failed an assignment. My patron is a jerk because he did not say thank you. You could see how those could be problematic. The last one that we're going to discuss here is personalization or blame. You blame yourself when you're not responsible. You take everything personally, or you blame others and overlook your role. Some examples: my kid fell on the playground today, so I must not be a good parent. Everyone at that party was rude to me for no reason. My friend had a terrible time at my birthday party. I should have planned better activities. There we have blame, and we have the should statements. We see the personalization and blame a lot with persons who grew up in a home with a parent who was overly critical. This wraps up our discussion about the 11 cognitive distortions that we're going to discuss here in this session today.
Welcome back. On session 4, we're going to be exploring cognitive distortions. And I am Dr. Nancy Donachie.
And I'm Dr. Jordan Brummett.
All right, Dr. Brummett. Let's start out with trying to help people understand what we mean when we say cognitive distortions.
So it's just that. It's distorted thinking. It's distorted ways of thinking and viewing the world and our experiences.
So really what we're talking about are inaccurate types of thinking. So it's a bit like looking at a situation or a person or something through, glass that's wavy. We're not really seeing things clearly and accurately. Is that your statement? Okay. Again, like we said with automatic negative thoughts, we all have them. Do we all have cognitive?
Absolutely. We all experience all of them at some point or another, but most of the time we identify more with one or two of them that we use pretty consistently.
Okay. So for some of us, we get into patterns of relying on certain ones of these, and that is kind of what leads us into sadness, anxiety, depression, hopelessness, things like that.
Yes, absolutely.
Okay. So why don't we talk about some examples of some cognitive distortions? And then we'll maybe give some examples and talk about them. Okay. So how about one that I think is very common that we all do from time to time, and that's all or nothing thinking.
Oh, yes. Everybody does that one. And so it's like you're looking at a situation and it's either all or it's nothing. You're either going to give me all of this or I want none of it. And so when you look at, let's see, I don't know how to put this in.
How's about this? You're in a morning conference and your boss is in there and you receive some negative feedback. Give me an example of an all or nothing thought that a person might have in that situation.
I'm a terrible employee. I'm going to get fired.
Correct. Even when in reality, you may have been in a meeting with your boss every week for weeks and everything went just fine. But based on this incident,
I'm a terrible employee. I am going to be fired. Everything's bad. Everything I've ever done is bad.
right. Another common one that I can think of is catastrophic thinking. Again, one that we probably all use from time to time. And in fact, very common, like let's say among college students who are getting ready to take a test. What is a good example of a catastrophic thought in that situation?
I'm going to fail this test and then I'm going to flunk the entire semester.
Right. How many tests have you taken prior to this test?
300.
And you probably passed
Absolutely.
all or most of them.
But this one, I'm going to fail and I'm going to flunk the entire semester.
This one's proof. Yeah. Yes. So, we attribute these thoughts to be very true and treat them as if it's absolutely fact, when in reality,
It's not. It's the lens that we're viewing it through.
right. And we're often speaking from, a place of our fears, our worries. And as we said, we bring, let's say your core value is that I am not worthy. And then you go in there with your boss and you have one incident where you have a negative experience. Why are you so quick in that situation to kind of glob onto that thought?
Well, because my core belief about myself is that I'm not worthy in the first place. And so anything that is going to reaffirm that core belief, I'm going to grab onto and say, oh, see, it was right. I wasn't worthy. I never was worthy. And so we look for those things to affirm those core beliefs as long as we have them.
So we're looking for that evidence while ignoring all the other.
Yes.
Exactly. So another one that's common would be like an overgeneralization. So you went on a date and it didn't go well.
I'm never going to date again. All dates are bad. All men are bad. All women are bad. Whatever the case, everything's going to be bad. All dates are going to be the same.
So Relate that back to a core value that could be going on behind that thought.
I'm not worthy of being loved and accepted exactly as I am. And so I go on this date. It's bad. Oh, well, see, I wasn't worthy in the first place. They're all going to go bad.
Even if you had 100 great dates in the past.
Or we could even take it because, we have core beliefs about self, but we also have core beliefs about the world. And so if I've had an experience in the past with, let's say I've had a bad experience with a male and I go on a date with a male and it goes bad, well, all men are bad. That's my core belief. All men are bad. I developed it early on. You're affirming it. There we go.
So if your boyfriend, who's been really kind of nice to you for months and months, has a bad day and makes an unkind comment,
Men are bad.
he just
Men are bad.
me.
Yep.
Mm-hmm. So we're really talking a lot here about how we filter the world, or mental filter. So our core values relate to those mental filters and the assumptions that we're making. So when we have distorted thinking, our assumptions and the facts that we filter out to rely on to test this thought are just very inaccurate, very distorted, lead us down a very negative pathway.
Yes.
Okay.
And that's why it's so important, like we discussed in our last session, that we recognize. That's the first step in all of this, is just recognizing those automatic negative thoughts and then figuring out what core beliefs they're attached to. Because when you recognize the core belief and you address it and you really step back and look at big picture, you can see that this core belief is inaccurate. It's irrational and it's not my world and it's not what I want my world to be. And then you can work to change it.
So let's take another common one, should statements. Things that we probably all do from time to time. Give us an example of a should statement.
So I should get out of bed every morning when my alarm goes off at the very beginning. The problem with that is when I have that thought of I should do this, but then I don't, I have negative emotions associated with that. And all of a sudden I think, oh, I should have done that. Now I'm a bad person. I did bad. I'm never going to be able to get up and get going and accomplish all the things that I want. And it's like this snowball effect.
Even though most people have a day when they're tired or, they didn't get good sleep and they don't want to get out of bed when their alarm rings. You ignore all of that and focus on this one incident.
And I should do this.
So let's talk about one additional cognitive distortion, emotional reasoning.
Okay, so emotional reasoning is closely associated with anxiety. We see it along with anxiety. And when a person feels anxious, there's no reason for them to feel anxious that they can identify. Well, then that must mean that something bad is coming. Something bad is about to happen.
And actually, they can feel very certain that something bad is going to happen.
Yes.
Okay. So another one that is common is personalization. So let's say you're out with friends and somebody makes some comment about how someone looks, and they're not really talking about you. What happens when you're somebody who relies on personalization?
Well, I remember that last week I looked very similar, and I all of a sudden think, well, they must think that about me too.
Right. So you're making predictions about what the other person's thinking based on this one little piece of evidence
about somebody else.
What about blaming?
I mean, it's exactly what it is. Blaming. You're blaming other things and other people for everything that's going on in your world without identifying what part you played in it.
Right. Another one that I think we should talk about a little bit is labeling. We all are guilty sometimes of labeling ourselves, labeling others. What happens when you apply those labels and you never test them out?
Well, the problem with labels are that it puts us in a box, right?
Yes.
So if I give myself a label, I'm going to meet that label and I'm not going to work outside of it. And so we want to be really cautious with what labels we do give. And that's where the cognitive distortion of labels, you see it through a skewed lens. The labels that you're attaching aren't accurate, but you're attaching them anyways, and then you live up to them.
And they're usually not positive.
Correct.
So it's usually a negative connotation that then we feel
Obligated to meet.
Yeah, we meet. Yes. So learning to recognize these things is not always easy.
No.
Because as we said, this is to some degree a part of normal thought process. But, when we're able to operate in a healthier space, sometimes we can say, well, now, hold on a minute here. Let me test this and see if I'm really accurate. I know I'm upset at the moment. I didn't like hearing that from my boss, but, we just had a good conversation last week. And, most of the time I do pretty well and my reviews have all been good. So I'm overreacting here. So when you can do that, you can help get yourself out of those negative emotions. So how does somebody who's really relying heavily on these distortions and really not cognizant of them is spending a lot of time feeling bad about themselves or about other important people in the world, how do they begin to identify these things and, more importantly, go through that process of checking them out?
So I think this is why it's important to work with somebody that's skilled and trained to identify these things. They can help you identify them, and then over time, you can start to recognize them yourself. You want to identify and recognize all of these things because this is what's keeping you stuck in that place of feeling so badly. All of these things that we've discussed up to this point. So when you work with your therapist individually, they can help you identify the different distortions that you're experiencing from time to time.
Because assumptions get us in trouble.
Yes.
Because they're often based on something like our experience, our emotions, but not on fact.
Absolutely. And this is why it's important to have safe people in your world. Your therapist is a safe person. And so maybe you test it out with them first. You check your thoughts. You say, hey, when you said this, I thought this. Is that accurate? Or when you said this, I heard this. Is that accurate? When you have safe people in your life that you can have those conversations with, then you start recognizing these patterns over time where you're mishearing, misunderstanding whatever's being said because of this lens. Yes, because of this lens that you're viewing the world through. And so it helps you identify and recognize, which again is the first step to being able to move towards change.
So what would be maybe an example of a type of exercise one might do in CBT related to addressing and testing out a thought like this?
So I think my favorite is the ABCs. You have the activating event. What is the event that happened that started this whole thing where you have this, you snowballed out? And so you look at the activating event, you look at the belief that's tied to that event, and then you look at the consequence of continuing to have that belief. And so eventually you come to the place where you dispute the original belief, and then you come up with a whole new belief to take its place. That's one of my favorite activities that we'll learn about in our sessions that we'll teach on.
So let's go back to one you brought up earlier. So your lens is, I'm not worthy. And so you're predicting that you're going to be rejected. So you're reacting to people in that way. How would you take someone through an exercise with that core belief behind it?
Okay, so if we were going to do examining the evidence, which I mentioned before, you would look at that thought. That thought is that I'm not worthy and I'm going to be rejected. The evidence for it is I have this thought. That's basically all the evidence that I have to support this at this time. The evidence against is all of the many people who have accepted me. And when I look at it, I see that the evidence against is so much bigger because I have so many people in my life who have accepted me. And then down here, my new belief is going to be, I might get rejected sometimes, but that doesn't mean that I'm not worthy of love, attention, affection, whatever it is that you're looking for.
So again, it sounds like part of going through and addressing these kinds of thoughts, these kinds of distorted thinking, inaccuracies in our thinking requires some work.
Yes.
And some practice.
Yes.
So what makes it worthwhile for a person to go through that process?
Well, as we discussed, these things are attached to emotions and depression and anxiety. And over time, when you work through these and you're able to have a more positive outlook on self and the world, then your level of depression is not as intense. And that's our goal. Again, I want to make sure that I'm very clear about this doesn't solve everything. This doesn't fix everything, but it minimizes the intensity of the things that we are dealing with and puts them in a place where they're more manageable.
Yeah, we all have to talk about coping skills, relaxing and taking time for ourselves, having a good social support. But this is an important coping strategy because this really addresses the root issues, our beliefs that we carry inside of ourselves and the thoughts that are generated, and then looking at the consequences to our emotions, to our choices, to our behaviors. So, very, very important coping strategy here.
Yes.
So, if someone decides they're going to begin working on this, um, how much practice are we having to talk about here? What kind of investment of time and effort is going to be required sometimes?
So they'll be meeting with their therapist once a week for an hour of time. And then in between sessions, you will be given homework. The purpose of that homework is to use those skills outside of a setting with your therapist there with you. Because the more that you use them, the easier they're going to be to engage in every single day life. And so we want you using them outside of our time together so that you're able to identify them and use them on your own. So each week you'll have some homework that's assigned to you that you'll do on your own. You'll come back the following week, discuss it with your therapist, and be assigned some more homework.
So it sounds like a lot of practical application.
Yes.
That's what you'll be learning about,
Yes.
right? So we hope with that those of you who are struggling with depression and anxiety will give some serious thought about being willing to take that step, that risk of engaging in cognitive behavioral therapy so that you can learn better skills to examine your thinking, your responses, your assumptions, to learn how to test it, and hopefully end up in a place where you experience fewer negative, hopeless emotions and in fact begin to feel more hopeful about things.
It's that time again. You guessed it, homework. When we begin to identify the cognitive distortions that lead us to negative emotions and self-defeating actions, we need to begin to challenge them. One way to do this is to test out your thinking by asking yourself a series of questions. Take the time to write down your responses so you can look over the evidence and determine if your thinking was rational or whether your thinking was distorted and a newer, more rational thought is called for. Some of the questions you might ask yourself: how will I feel if I keep telling myself this? What might happen if I change how I am thinking? What evidence exists to make me think this is true? If you take a look at the activity, How to Squash Cognitive Distortions, you start off by describing the situation. That includes the trigger, the thought, the emotion, and the action or behavior that's typically related. In this situation, which cognitive distortion are you using? I want you to start by sharing the story that you're telling yourself about this situation. Next, what emotions does that story trigger in you? And then lastly, what's the consequence of that thought and those emotions? Typically, it's a behavior. Now, once you have that side, I want you to think about what is your desired action? Then, what emotions would drive that action? And last, what thoughts would create positive emotions? Your new thought is another way to look at a situation that is not based on emotion or negative assumptions. Sometimes it can be helpful to remind yourself, what is the absolute worst thing that is likely to happen here? And then, what is the absolute best thing that could happen? When we can work toward clear and fact-based thinking, we see more hope and we are empowered to see more choices for our lives. We do not have to stay in a self-defeating cycle. Another activity to help you recognize your cognitive distortions is the Cognitive Distortions worksheet. Number 1, which one of those cognitive distortions resonated with you the most? How does that set you up for failures? In what ways do you feel pressured? How does that impair your daily functioning? Next, in what ways is this style of thinking self-defeating? Then, what emotion does this style of thinking trigger? This style of thinking makes you feel what? Defeated, stressed, embarrassed, ashamed, pressured, hopeless, helpless, judged, misunderstood, unimportant, blamed, guilty. Then, if you could continue to have frequent occurrences of this style of thinking, you will continue to feel what and behave how. Then you look at the benefit of changing your ways of thinking. What are those benefits? Go ahead and list them out. Lastly, from 0 to 100%, how important is it to me to change this style of thinking? Again, I want you to go back and connect this with what we discussed before about core values. Is this line of thinking impacting your core values in a negative way? Is it impacting your family, your friends, your work? If so, maybe it's time for a change.